Hi, I'm Sean, one of the editors at Manx Radio. Now, an MHK believes making it legal to buy and use cannabis recreationally on the Isle of Man would reduce the harm caused by the drug. Next month, Ramsey MHK Alex Allinson will be asking Tynwald to set up a citizens' jury to examine timelines and policies for a future regulated environment that would allow for the sale of cannabis recreationally. So just what is that citizens' jury and how would it reduce harm? I've been speaking to Dr. Allinson.
So when I came into Tynwald in 2016, one of my personal ambitions was to get drug law reform back on the agenda. As a doctor, I've seen the harms of drugs, but also the benefits of things like medicinal cannabis. I've also seen the harm of incarceration and criminalisation, particularly of young people, for recreational cannabis use. In 2023, we had a landmark report from John Moores University in Liverpool about drugs on the island and a whole range of ways that future policy could be determined according to harm reduction. In 2024, we had the Department of Home Affairs and government setting out clear policies on a harm reduction approach. We're now in 2026, and some of that work has stalled for very good reasons. In the 2024 report, one of the key conclusions was that there should be further investigation of possible future regulatory regimes that will be required, but that would need detailed public consultation. Now, we've seen over the last particularly 2 to 3 years, a bit of dissatisfaction with some of the public consultations we've had around complex social issues, whether that's the bishop's vote, assisted dying. We need a better way of engaging with the public on quite complex, non-binary issues to explain the complexity, but also to hear all the different voices within our community. So this motion is to try to get what's called a citizens' jury set up to look at some of these complex issues. Now, we've never really done this before on the Isle of Man. We've had Comyn road shows, we've had lots of ways of trying to engage the public. But in the United Kingdom, in Jersey in particular, they've set up citizens' juries to look at some complicated issues, such as assisted dying, such as climate change, whereby you get a representative sample of the population. They're presented with all sorts of different evidence. They can call evidence from people like doctors, the constabulary, the law enforcement, to look at the harms of drugs on our island, the consequences of an increasing prison population, but also the necessary benefits of medicinal cannabis as well, and look at how we could determine better policy based on the evidence we have. In parallel with this work, there is an organisation that's been set up to try to promote for regulated supply of recreational cannabis on the island. It's called Traced. Charlotte Caldwell, who's the mother of Billy Caldwell, who was a young child with intractable epilepsy, is leading this, and I support some of their moves to look at evidence-based ways where we could provide for recreational cannabis for people with the right quantity, quality, so that we can try to reduce criminality on our island.
As you mentioned, this is a topic you've taken an interest in before. You've been involved in consultations around medicinal cannabis, certainly. Is there a will for this change on the island?
When you look at the consequences of drug use on the island and the harms these can bring, it's significant. We have quite a large prison population which is for use of illegal drugs. We know it's an issue on our island, and I think we also know that the so-called war on drugs is not working, that we still have people who are willing to take drugs. Again, that's not an island problem. If you walk around the streets of any large city in the UK, the smell of cannabis is pervasive. It's the reality. So how can we ensure that people who are using cannabis on the Isle of Man are not getting it from criminals, are getting something that is relatively safe to use, that they know what they're taking, so we can reduce the harms of drugs? I think there is a lot of support for that, to have a pragmatic approach. There is a lot of evidence about that as well. Over the summer, Public Health will be doing quite a lot of work. They've already finished a consultation in terms of medicinal cannabis use, which has been promoted on our island, and I personally know of people who are getting great benefit from it. But also looking at particularly younger people and the way that they are drawn into criminal activities through drug use and trying to circumvent that as well. So it will be interesting to see what the public response to this is. This is a conversation we've had many times, and we've seen lots of jurisdictions all around the world, particularly in Europe, changing their drugs law and legalising cannabis use without the sky falling in. I'd like to see if we can have the same debate here, but we need to engage the public. And so that's why setting up a citizens' jury could be one route to doing that and fulfilling the ambitions of the 2024 report from government.
In terms of that jury, how would that work? Would their findings be binding? Would there still be a Tynwald vote? What would be the issue there?
A citizens' jury is a way of consulting with the public, a way of making sure that people can see as much evidence as possible and can also look at the various decisions that need to be made and the balances between sometimes quite complex relationships between harm, benefits, costs, cost reductions in terms of the criminal justice system. What a citizens' jury does is present a report which basically looks at all the evidence and steers government towards a particular direction. Whether that government and whether that Tynwald wants to follow that direction is completely up to them. So it's certainly not a binding decision. That has to be made by the democratically elected members of Tynwald. But what it does is helps them understand both the public perception but also the public appetite for progressive change.
Now, you talked about the potential for change and how it's worked elsewhere. There will be some people who will see cannabis as harmful, potentially dangerous. What would you say to those people?
I would agree with them. I think unregulated cannabis can be harmful and potentially dangerous. Some of our young people are taking drugs which they don't know what they're taking. They have got no idea what the constituents are. They're buying it from criminals. Particularly with cannabis, it can be very poor quality, very high THC content, and can lead to health problems. It can also lead to financial problems, involvement in criminality, and eventually arrest and prosecution. So there are harms there, absolutely. However, by just arresting people for being in possession of cannabis or for using cannabis or growing cannabis for their own consumption isn't really helping. This problem isn't going away. And so I think looking at it in terms of a harm reduction approach, particularly from the medical side, and looking at things like the rates of psychosis in young people and how we reduce that is very important. And by being open about drug policy, I think we can achieve far more than just making a criminal offence and locking people up.
Thank you for making it to the end of the Manx Radio newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider so our best bits will magically appear on your smartphone. Thank you.